And thank you for staying with us. Peripheral artery disease, better known as PAD, impacts approximately 8.5 million people in the United States, including about 12 to 20% of individuals older than age 60. But what is peripheral artery disease? Well, here now to share more information on the risk factors and how to lower your risk is Dr. Danielle Bajakian, who is the vascular surgeon at Columbia University's Irving Medical Center, and we welcome you.
Thank you so much for having me on the show today.
Good. So when we talk about this, I mean, obviously it's not something that many people are familiar with, but I guess when you face it, you have to deal with it. So can you educate us a little bit more about peripheral artery disease?
I can. Actually, one of the reasons why I'm so thrilled that you're having me on the show is that even though this problem affects over 8 million people, nobody knows what it is. And so early diagnosis is important. So peripheral arterial disease is really simply blockages in the arteries that feed the circulation to the legs. Those blockages are caused by atherosclerotic disease or plaque. It's the same type of buildup that causes heart attacks in the heart. That's the same type of problem. When it's in the legs, it's called peripheral arterial disease.
So you say there's a lot of people who walk around, and they walk around undiagnosed, right? So how do we find out what are some of the symptoms of this?
So peripheral arterial disease, for some people, it's asymptomatic. However, the earliest symptoms are pain in the legs or cramping in the legs when walking. So the typical description is when you walk a certain distance, your legs start getting achy, tired, you get cramping in them, you stop, and after a certain amount of time, that pain goes away, and then you can start walking again. That's the earliest symptom, and it's called claudication. As this disease progresses and becomes more severe, that pain can become constant. You can develop wounds in your legs and your feet that don't heal, and then in its most severe form, it can cause gangrene. At that point, there's a high risk. If it's not treated urgently, you can end up with amputation. So the earlier the diagnosis, the higher the likelihood of successful treatment.
And I know every doctor wants to do something about terms of lowering risk and trying to make sure that we can, keep these numbers down. What could an individual do to lower their risk to really put them in a place of, better possibilities here?
So that's a great question. I think the first thing that people need to understand is really the risk factors involved with the disease in order to lower the risks. So those risk factors, age is one of them. There's really nothing that you can do about that.
Right.
Age over 60 is a significant risk factor. Diabetes, high blood pressure, obesity, high cholesterol, and smoking. And so the things that we can do to lower our risks are go see our primary care doctor regularly, obviously. Nobody really wants to do that, especially when they're feeling young and healthy, but controlling your cholesterol, controlling your diabetes can prevent you from ever needing to come into my office. The other things that we can do to regulate this type of problem is smoking cessation. Everybody knows smoking is bad. People have a hard time stopping. But if you have other risk factors, if you have diabetes, if you have high blood pressure, and you smoke, you're doing yourself a particular disservice, and you can end up with an amputation if you don't modify those risk factors.
So I know you had a recent event. You had a workshop in May. Talk to us a little bit about this workshop that took place in May and what happened.
Great. So this actually was the most recent in a couple of events that we've had in the Bronx over the past couple of months. And the reason that we had them is that nobody knows what peripheral arterial disease is. And outreach to physicians is helpful, but really getting the word out to patients before they have the problem is really useful. So what we did with this most recent event, it was a cardiologist and myself, and we didn't particularly lecture about risk factors. We actually brought in a mutual patient that we both shared. She shared her story with the people in this community center. She was a part of the community center, and she told her story, and I just want to briefly tell it to you because I think it really, it exemplifies a lot of the problems that we have in diagnosing and treating this problem. She was a little under 60 years old. She had been a long-term smoker. She didn't have a primary care doctor. She really felt fine. She didn't know she had any problems. She started developing pain in her legs when she was walking. She went to a few emergency rooms. They sent her out with pain medication, an orthopedic appointment, an x-ray. She went back many, many times. She ultimately developed wounds in her legs. Lucky for her, she had a family member who was in the healthcare community who sent her to her cardiologist. We quickly diagnosed her with a circulation problem with these blockages, and because she already had wounds in her feet, she needed intervention. So we did a combination of a surgical procedure and then a minor procedure with wires and catheters and stents. We improved her circulation. She's walking again, her wounds are healed, and she is now going to be a lifelong patient of myself and this cardiologist. And so she told her story about having a lot of trouble getting health care. She went to the doctor, but it wasn't the right doctor. She was going in for emergency care.
Right.
And because this is an underdiagnosed problem, even the doctors who were seeing her didn't recognize it.
Amazing. But now I want to get to one question before we get out of here, because you talked about treatment, right? So when a person is diagnosed, what are the treatment options that are available for them?
So that's a great question. A lot of people are afraid to come to see me because I'm titled a vascular surgeon and they're worried that they're going to get surgery, but that's certainly not always the case. The beginning therapies are really medication and lifestyle changes. And for patients with early disease, an exercise program and medications can be all that you need for these beginning stages, and that can sometimes reverse the process. In its more severe form, there are a lot of different treatment options other than big surgical procedures to fix these types of blockages, and those are called endovascular therapies. And really what we do, there's no incisions, it's wire and catheter-based therapy. We sometimes crack these plaques open with balloons, sometimes put stents or metal scaffolding, and there are a lot of other technologies that we can do with these wires and catheters, especially being at an institution such as Columbia, we're a major university. We have these technologies before they're available to the public. We're involved in a lot of trials for newer technologies. So there are a lot of new treatment options that require minimal recovery. Some of them are outpatient therapy, and patients can go back to their normal activities the next day even.
Hey, amazing. So for people who want more information, what do they do?
So the first step is to involve your primary care doctor in your therapy. So for everybody who I listed these risk factors, if you're going to see your primary care doctor or your cardiologist and they're not taking off your shoes and your socks and examining your pulses in your feet, you're not getting a thorough exam. For patients who really suspect that they have some of these symptoms that I described, an appointment in my office, even if you come into my office and I tell you that you should modify your risk factors and you have no circulation problems, you're better off getting an evaluation very early on if you have risk factors so that we can modify your risks and hopefully prevent you from ever needing to come into my operating room.
Well, Dr. Bajakian, thank you so much for coming, giving us the awareness, the information, and hopefully people will take advantage of knowing a little bit more about this. Thank you so much.
Thank you very much for the opportunity to be here.
All righty. Well, listen, we encourage you to stay tuned for more Open coming up after this, but you heard the doctor. Make sure you get yourself checked out. We'll be right back in a few.